Now, anxiety is a hard thing to diagnose because it's an emotion. Everybody is going to feel anxious at times. So how do you know if you have a normal amount of anxiety or if it's reached some level or it's impacting your life in such a way that it's an actual anxiety disorder? Today we're going to find out. So what do you guys think of the sweater? It's kind of 50s, it's kind of mod, maybe it's skater, 1990s. It could be timeless as a Mr. Rogers kind of a look. I don't know, I like it. The office gets cold the way that the heating and cooling system works here. It's hard to get all the offices to be the right temperature, so I got myself a sweater. Anyway, let's get to the topic here. Everybody's felt it, everybody's experienced it, everybody's been anxious. It's a normal human emotion. In fact, it's a helpful emotion. It's supposed to keep you safe. When you feel anxious about something, it's supposed to be something that's dangerous. And the only thing that cures anxiety is to escape the thing that is dangerous. Or if you can't escape it, if you can fight back in some way, that could fix the problem too. So anxiety is supposed to make you either fight off whatever's getting to you that you need to save yourself from, or flee, get out of the situation. That's the fight or flight system. Now they've also added freeze. I guess sometimes when people are anxious, they just freeze up and they don't know what to do. Now the problem comes when there really isn't any danger and you're just anxious about either nothing or something that most people wouldn't be that anxious about. So it's a matter of degree, it's a matter of frequency, and we're going to go through the specific criteria from my favorite book, the DSM-V, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It came out in 2013. Now they actually came out with a text revision of this in 2022. I still need to get that. Here's the real version of it. This is the little summarized version of it. So in the book, there are actually several anxiety disorders. For example, a specific phobia. We also have panic disorder and agoraphobia, separation anxiety disorder. There is social anxiety disorder. And many people don't know this, but a lot of times anxiety can be induced by certain substances. So you can have a substance-induced anxiety disorder. But today we're just going to focus on generalized anxiety disorder. And if you're interested, leave a comment below about other anxiety disorders that you're interested in hearing about. In fact, leave a comment about any topic that you think you'd be interested in hearing about. Also, I'll just say it right now, get it out of the way. If you think you're going to like the video, click like. If you already liked what you heard so far, click like. But the good stuff is still coming. Be sure to subscribe. I'm coming out with more videos on topics. So if you subscribe and hit the bell, you'll get notified when they come out. Criterion A. I'll just read it right out of the book here. Excessive anxiety and worry, such as apprehensive expectation, occurring more days than not for at least 6 months. So they always want to give it a time span because it might just be a phase or something that you're going through. But if it's lasting at least 6 months, then it is not your typical anxiety, and it may be an actual disorder. Criterion B, the individual finds it difficult to control the worry. A lot of the time, if we're worried, we can talk to somebody and then we start to feel better, or we can distract ourselves, or we can try to look at the situation in a different way and it seems to help. If you're having trouble controlling the worry and the worry is there no matter what you try to do, you've met Criterion B. Criterion C. The anxiety and worry are associated with 3 or more of the following 6 symptoms. So I'm going to read all 6, and if you find that you meet the criteria, 3 of those, then you've met the Criterion C criterion. You've met the criteria for item C, let's call it that. Now a little side note here, if we're talking about a child, only 1 of the following 6 items are required to meet Criterion C. So here we go, all 6 of them. Number 1, restlessness or feeling keyed up or on edge. We all know what it feels like to be stressed or keyed up or on edge. That's number 1. Number 2, being easily fatigued, where you feel run down and you really don't have an explanation for it. You've gotten enough sleep, There's no reason that you should be run down, but you just kind of feel run down. Number 3, difficulty concentrating or your mind going blank. Number 4, irritability. If you find yourself getting irritated or annoyed by things that you don't think should cause that much irritation, and it's occurring in the cluster of these other things that we're talking about. Number 5, muscle tension. Of course, anxiety, muscle tension, they go hand in hand. And number 6, sleep disturbance. And they explain a little further, difficulty falling asleep, or you might have difficulty staying asleep where you're waking up at night, or restless, unsatisfying sleep. So even if you are sleeping and you feel like you're kind of waking up, or it's this light, non-restorative sleep, that would meet criterion C6. Look at those 6. If you got 3 of them, then you've met the criterion for C. Criterion D. The anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So that is an add-on to almost every disorder. If something's going on and you're not feeling any distress about it, and it's not impairing your ability to function at home or at work or other important areas of functioning, then it's technically probably not a disorder. Criterion E is also usually added on to any disorder, and that is that the disturbance is not attributable to the physiological effects of a substance. So if there is a drug or a medication or some other substance that is known to cause anxiety, or a medical condition such as a hypothyroidism is one of the examples they give, then you would probably meet the criteria for substance-induced anxiety disorder, or anxiety disorder due to a general medical condition. And the last one, Criterion F. Criterion F is basically just giving you some other disorders that if you meet the criteria for that disorder, then it probably isn't generalized anxiety disorder, it's probably this other disorder. Let's go through these, because there may be a lot of people out there who are suffering some form of anxiety and they don't seem to really meet the criteria for generalized anxiety disorder. So if the anxiety or worry is about having a panic attack, you're freaked out because you've had a panic attack and you're so worried you're going to have another one, then it may be panic disorder. If your anxiety seems to really focus around social situations, being afraid of being evaluated or judged negatively, then it could be social anxiety disorder. If your anxiety seems to focus on being worried or concerned about intrusive, unwanted thoughts you're having, or thoughts about being contaminated, or thoughts about hurting somebody unintentionally, or checking locks, washing hands, any of that kind of stuff that seems to be OCD type behaviors, then you might want to watch, in one of these corners there's going to be a video on OCD, so you can look at that one if you're interested. If the fear or anxiety is mainly about being separated from a loved one or something harmful happening to a loved one, and so you don't want to let them out of your sight or be away from them, then you might meet the criteria for separation anxiety disorder. This usually happens in kids, but it can be in adults as well. If your anxiety is focused on a traumatic event, a near-death experience, or witnessing a near-death experience, or having some sort of abuse situation that happened over a period of time that was very traumatic for you, and reminders of that event trigger a high amount of anxiety, then you might meet the criteria for post-traumatic stress disorder. Now, some people with anxiety have what's called body dysmorphic disorder, where you're so concerned about some body part that you feel is grotesque or unusual or abnormal, and you think everybody's noticing it, and it just consumes you. Now, everybody has certain things that they don't like about their looks or their appearance, but if it's something that is really impairing your functioning, or it's causing a significant amount of distress on a regular basis, you might look into talking to a doctor about body dysmorphic disorder. If you find that your anxiety is focused on getting some illness, or that you maybe have an illness and don't know it, or you think you're having symptoms of an illness, or you've read something online about a certain medical condition or a psychiatric condition, and you keep worrying that you have it or you're going to get it, then it's possible that you have illness anxiety disorder. Thank you for watching the video. Again, if you liked it, click like and subscribe, and I won't waste any more of your time. Have a good one, and remember, psychology works.